Imagine a skilled detective equipped with advanced technology snooping out clues in a complex crime scene, except in this case, the crime scene is a tissue sample, and the detective is a revolutionary lab technique named immunohistochemistry. Since 1941, immunohistochemistry, or IHC, has been a crucial tool used by histologists, pathologists, oncologists, and researchers alike to uncover markers of disease using antibodies and antigens. Think of antibodies as the star of our immune system, proteins constantly circulating throughout the body, looking for harmful cells disguised as self, such as tumors or foreign pathogens such as bacteria. To identify these intruders, antibodies look for antigens, defined as any substance capable of triggering an immune response. When antibodies recognize antigens, they bind, with the goal of destroying the antigen and returning to homeostasis. Antibodies can either be primary, binding to antigens directly, or secondary, binding to primary antibodies that are already bound to antigens. Depending on the shape of the antigen binding site, known as the epitope, certain antibodies fit with antigens differently. The stronger the affinity, the easier the subsequent destruction. IHC takes advantage of this binding, looking for the presence or absence of antigens, most often in a colorful or fluorescent staining, to find proteins, classify tumors, and diagnose patients in a simple, cost-effective way. So how does IHC work? Let us walk you through a simplified step-by-step process. First, sample preparation. This involves collecting tissue, preserving it in formalin to maintain structure, embedding it in paraffin wax for stability, and then slicing it into thin sections for analysis. Next, deparaffinization with xylene removes paraffin to expose the tissue. The tissue sections are then progressively brought back to full saturation by a succession of progressively weaker alcohol baths, which conclude with water. Antigen retrieval is a common next step. The slides are heated/boiled in buffers of varying pH or treated with enzymes to reveal antigens that may have been obscured during the fixing procedure. In the blocking phase, the tissue's nonspecific binding sites are blocked to stop nonspecific antibody binding, ensuring only target antigens are marked. This is usually achieved using a solution containing proteins like serum or other blocking agents. Primary antibody incubation follows, where antibodies designed to target specific antigens are applied. Only the target antigen will bind to this antibody. After washing away excess antibodies, we move to secondary antibody incubation, introducing a secondary antibody that binds to the primary and is equipped with markers like enzymes or fluorescent dyes for detection. Counterstaining is an optional step. The tissue can be counterstained with a dye like hematoxylin to give contrast and enable the study of tissue shape. Finally, the tissue sections are covered with a cover slip coated with mounting media for visualization. Microscopic visualization reveals the precise location of proteins within the tissue, offering valuable insights into cellular function, disease's molecular causes, and treatment's efficacy. In IHC, getting accurate results depends heavily on the precision of your methods. Here's what you need to keep an eye out for in some key steps. When sectioning your tissue, it's critical to ensure each slice is around 4 micrometers thick. Thickness matters because sections that are too thick or too thin can lead to misleading signals, making your results difficult to interpret. During antigen retrieval, the main concern is finding the right balance. Too short, and you may not unmask all the antigens, leading to weak staining. Too long, and there's a risk of destroying those very antigens you're trying to detect. This step is crucial for making your target antigens accessible without compromising their integrity. In the blocking phase, insufficient washing can leave behind excess proteins, which obscure your target antigen. This can result in nonspecific binding, where the stain doesn't accurately represent the presence of your target. Make sure to thoroughly wash after blocking to ensure clarity in your results. Handling endogenous peroxidase is another critical point. This enzyme can cause overstaining if not properly blocked with hydrogen peroxide, as it reacts with the staining reagents. Finally, when it comes to antibodies, concentration is paramount. Using too much can lead to overly strong staining, masking the nuances of antigen distribution. Conversely, too little may result in faint staining, where your targets remain hidden. Selecting the right antibody and adjusting its concentration based on the tissue and antigen of interest are essential for clear, interpretable results. Sometimes you might run into problems like not being able to see anything or seeing too much background stuff you're not interested in. For weak staining, make sure your sample isn't too old, you're using the right fixative, and your antibodies are at the right concentration. You might need to leave the primary antibody on longer or use a more sensitive detection method. If there's too much background staining, it could be because your tissue sample wasn't washed enough, leaving unbound antibodies on the surface of the tissue. Alternatively, the antibody concentration could be too high or the sample was damaged. Make sure to cut your samples thin enough, use the correct antibody concentration, and carefully wash your samples. So, in IHC, it's all about following the steps carefully and paying attention to how you prepare your sample and use your chemicals. This helps ensure you get accurate and useful results. Perfecting IHC is incredibly important, as it plays a crucial role in disease diagnosis, research, and drug development. What IHC does best is determine the antigen and its distribution in the tissue of the disease of interest. Most notably, IHC is used in cancer diagnosis. This is due to the specific tumor antigens that are expressed. Pathological uses of IHC are used in oncologic pathology, neuropathology, and hematopathology. Doctors can use specific tumor markers to identify a cancer as benign or malignant. Physicians can also determine the stage of the cancer and grade of the tumor. It can also help to identify the type of cell and where the primary origin of the cancer is. These abilities of identification can allow for the development of personalized medicine based on the individual's proteins present in tumors. In drug development, IHC is useful in detecting the up or down regulation of a disease target, overall helping drug efficacy. As you can see, immunohistochemistry is a crucial technique that helps us see and understand the tiny details inside tissues, making it an essential tool in scientific discovery. A few takeaways include: IHC looks for the presence or absence of antigens, usually in a colorful or fluorescent staining, with the goal of finding proteins, classifying tumors, and diagnosing patients in a simple, cost-effective way. The steps of IHC include sample preparation, deparaffinization, antigen retrieval, blocking, primary antibody incubation, washing, secondary antibody incubation, detection, counterstaining, and visualization. Lastly, in terms of challenges, there are many, ranging from low staining to high background staining. To combat this, make sure that you are following the steps carefully and paying attention to how you prepare your sample and use your chemicals. This helps ensure you get accurate and useful results. We hope you learned a bunch, and as always, stay tuned for more insightful and educational videos on our channel.